thank you all for coming today. We're very glad to host this event. My name is Merrill Thomas. I'm the CEO of the Providence Community Health Centers. We take care of 60,000 people here in Providence, one of 8 health centers in the state, where we take care of about 165,000 people. I'm very happy to talk about the Accountable Care Act. I was just telling the governor, when people say that, you get all kinds of reactions. Do you like the 26-year-old you can say on your parents? Yes. Do you like the no pre-existing conditions? Yes. Do you like you can get exchange? Yes. Do you like the ACA? No. I don't like Obamacare. And so people don't understand a lot of the details of what's going on. And to me, this was the most significant healthcare change in my 33 years of working at health centers. More people got insured, more people got coverage. This is not numbers, it's not politics, it's not red versus blue. This is people. This is your family, your friends, your neighbors getting healthier. We actually have an example right here of a person, and to me it's even life and death. People that didn't have insurance would not be here today if it weren't for the ACA. So I'm very happy to host this event, and I'm going to introduce you to example of Mr. Richard Nuno.
Thank you.
Richard?
Thank you. My name is Richard Nuno, and I am the Education and Resource Center Manager at the Brain Injury Association of Rhode Island. I'm also a survivor of brain injury. 16 years ago, life was really good, but then dizzy spells required me to visit my doctor, who sent me to a neurologist. And an MRI revealed I had a number of malformed blood vessels in my brain, and they were bleeding. So 16 years ago, I was treated with a gamma knife at Rhode Island Hospital to close off 27 malformed bleeding blood vessels in my brain. After that, I had to relearn language, how to read, how to write, fold a blanket, tie shoes, turn faucets on and off. So basically, I relearned everything that we assume will always be easy and automatic. Survivors often recover from brain injury, but the brain can repair around the damage. But it takes years of very hard, frustrating, tedious work, and the brain can only repair when a survivor is asleep. So for the first 6 months, I was sleeping 20 hours a day, and then eventually I was sleeping 18 hours, then 16 hours, then 12. And during that time period, I gained 80 pounds. And this led to a number of other health issues. High blood pressure, very high cholesterol, and eventually diabetes. I take 9 prescription medications in the morning and 5 medications at night. These medications basically keep me alive. My employer is not able to offer health insurance, and so I depend upon the Affordable Care Act for my health care. The ACA allows me to continue my journey of recovery from a brain injury. The ACA was created to allow people like me access to health care they need. The Affordable Care Act protects those who are most vulnerable, the ones who are most at risk. The ACA allows me access to my doctor, my neurologist, and professionals who focus on brain injury. So I urge you to protect the most vulnerable in our society and protect the Affordable Care Act. For many of us, the Affordable Care Act is a lifeline. It's literally a lifeline between life and death.
Thank you, Rich.
Yeah. Governor Raimondo?
Amazing.
Thank you.
Thank you, Rich. I met Rich a month or so ago, and I think he has an inspiring story. We're here to talk about the Affordable Care Act, and I'm going to do that in a minute and sign the executive order, but I'm just so inspired by your courage and strength and determination, and we want you to keep going.
Of course.
And that's what this is about, to make sure you can keep going. But I think you're amazing.
Thank you.
Yeah, and thanks for telling your story.
Well, thank you.
A lot of people like you, I've been having press conference. This is, I don't know, my 4th or 5th press conference in the past 2 years to fight for the Affordable Care Act, maybe more. And we always bring forth a Rhode Islander to tell their story, and it makes a difference, and so thank you. This will make a difference to tell your story. It's like Merrill said. Yeah, maybe people don't like Obamacare, but we sure as heck like our neighbor, like Rich, and we want him to be healthy and alive and have health care, so we're with you. Thank you all for coming. Special thank you to Senator Miller, who hasn't yet been recognized, but who is probably the single greatest champion in the Rhode Island State House for access to health care and the Affordable Care Act, so thank you. Zach Sherman, who runs our health exchange, one of the best in America. Good job. Eric Beane, our amazing secretary of VOHHS, covers so much waterfront, runs a third of the government, so thank you. And Marie, who's our health insurance commissioner, who holds our payers accountable and does a great job doing that. So today, in a few minutes, I'm going to sign an executive order pledging to the people of Rhode Island that we're going to do everything in our power, everything that we can do, to make sure that the Affordable Care Act stays strong and sustainable and robust in Rhode Island. It's important. What's important to know is the Affordable Care Act is working in Rhode Island. You know, by and large, it is working. You know, nothing's perfect, but we have over 100,000 people, our friends and neighbors, who rely on the Affordable Care Act for their health care. Since it's been in place, our exchange, we've cut our uninsured rate by 2/3. Nearly everybody in Rhode Island has health insurance now. I think it's about 95% of Rhode Islanders have health insurance, 97% of kids have health insurance. Our health exchange, which is run in the state, is one of the best in America. We have choices, we have kept premiums low, and there are options. There's more work to do, but it's important that people know, by and large, this is working. And so every time something comes out of Washington, which tries to destabilize the market, tweak the Affordable Care Act, we got to stand up against that, because Rhode Islanders' lives and health care is at risk and is at stake. Why are we here today? As I said, I've taken a great deal of action since I've been governor to shore up the Affordable Care Act and the exchange. The first, I guess, fight I had with the legislature, or in the legislature, the second I became governor, was to make sure that the exchange stayed state-run. Thank God we did that, because now we have our independence, and thank you to the legislature for helping me to get that done. Now we can do what we need to do, and you know, we have some insulation from the Trump administration. And we've continued over time to pass legislation that shores up the exchange and makes sure that we have options and that we're going to keep premiums low. So why are we here today? Recently, President Trump has been making a lot of noise about so-called junk plans, wanting to sell junk plans on exchanges and push junk plans to people. And so Marie, who I think is going to say a few words, has been hearing from insurance carriers who say, essentially asking if they can sell these junk plans on our exchange. And I've been hearing from a lot of Rhode Islanders saying, are you going to allow that, Governor? Is this going to happen? So I thought it was very important, again, to come together and sign an executive order and give a loud and clear message to everybody in Rhode Island and to those insurance companies that we're going to keep the Affordable Care Act working here. We're going to keep our exchange intact. We're going to do more to invest in our exchange to make sure that there's even more options, higher quality options, more access, and lower cost. And that's what today is about. So this executive order, with this, I'm directing my team to look at every possible tool at our disposal to shore up consumer protection on our exchange, and come back to me with every piece of advice you have around regulatory changes, statutory changes, other changes that we should be making to further strengthen our exchange, further protect Rhode Islanders, and guard against these predatory health plans that the President wants to be made available. So that's what this executive order is all about. I expect it will not be my last executive order as it relates to the Affordable Care Act, because the President is continually trying to chip away at Rhode Islanders' health care, and we're not going to let it happen. Bottom line is, as long as I'm your governor, we are not going to let it happen, and we're going to use every tool at our disposal to protect people like Rich. Rhode Islanders should not have to choose between paying their mortgage and going to the doctor. They should not have to choose between paying their bills and getting life-saving treatment like Rich got and like our friends and neighbors need and deserve. So in a couple minutes, I'm going to sign that executive order, but first I want to offer Marie a chance to say a few words.
Thank you, thank you. I just wanted to add that when you look across the country and you look to see how different states have responded to the Affordable Care Act, you can actually see the influence that governors have made and the positions that governors have taken. We are very, very fortunate here in Rhode Island that Governor Raimondo has given us the authority and the resources that we need, all of us on her team, and also in support of legislative action, so that we have been able to fully embrace and fully take advantage of the Affordable Care Act. So I'm just very grateful to be here. We will continue to fight because we know that the challenges will continue to be thrown our way. Thank you.
Thank you. Not to put you on the spot, but would you like to say a few words because you are a champion?
Just to highlight the kind of protection that you have currently under the ACA for your prescription drugs. If we didn't have policies that covered all essential benefits, which is one thing the Trump administration is pushing, that people could actually introduce health insurance policies in Rhode Island without a drug benefit. And to use you as an example, because you were courageous enough to tell your story, that's the kind of health insurance they're interested in putting in our market. And without an executive order and the support of legislation that would protect essential benefits, also essential benefits for recovery services in a opioid crisis, also essential benefits would cover access to mental health care, maternity. Just imagine a health insurance environment where those essential benefits weren't covered. So I've always had that as a priority. This will be the third year coming up in 2019 that I'll propose legislation and the Senate passed. So that's a good example with you and this executive order being here.
Good. Thank you.
Yep.
Okay. So the executive order is entitled Maintaining Low Premiums and Protecting the Affordable Care Act in Rhode Island. And it goes through how Rhode Islanders, regardless of pre-existing conditions, deserve health care. Rhode Islanders should not be subjected to a lifetime maximum coverage limit. And it references serious illnesses and chronic illnesses and cancer. And then goes through that I'm directing my department to do everything within our power to protect this.